Okay, I am Sonia, Dr. Sonia Richards. I am currently working in the Wellcat clinic, looking after the students and addressing their, healthcare needs. But my overall position, I am an infectious diseases specialist and an internist. Yes, I started out, I left at home at 17 and went to Cornell University. Spent 4 wonderful years there and on to medical school at the University of Pennsylvania. I always loved microbiology. One of my professors there was just fascinating, so it just got me interested in micro. And then I went on to UCLA and did an internship and a residency and just entered the workforce. I was a general physician for several years, but eventually went back to USC and did a fellowship in infectious diseases because I always loved micro and it stayed with me. So that was my first love and I eventually did do it. Well, originally, from when I was at university at Cornell, my major was biology. And biology is a STEM subject. It's a natural science, but it does rely on several of the other sciences. So I think one can enter medicine from many different areas, but you really need an interest in science to be, to pursue this as a career. Yeah, I am really proud of international work that I did. I'm a language buff and I enjoy traveling, and I got to do a combination of medicine and travel, which was wonderful. I did research in HIV and TB back in the heyday when HIV was one of our major medical conundrums. And I published some work in TB, so I'm very proud of that. I'm also very proud of 2 years I spent at CDC as a disease detective in the EIS program. Very proud of those 2 years. It was in the 80s, yes, and I spent time in Côte d'Ivoire. The CDC had a center there that was set up, so people were able to go from CDC and do research in Africa, and I was able to study TB patients, and actually we made the link between TB and HIV at that time. What will make one a good physician and what would make one a good researcher is probably a little bit different. I think to be a good physician, the requirement will never change. I think you have to just be interested in people and to have a deep well of empathy. You have to listen to your patients and sit down and really care about what happens to them. I think just being smart and doing well on exams does not make you a good physician. I think it's your ability to feel empathy for your patients and to put yourself in their shoes and to try to be understanding. I think those are lifelong qualities that will never change as far as being a good physician. Now, being a good researcher, yeah, probably it helps to be brilliant and to remember information and to have innovative ideas and to certainly develop your problem-solving skills. Yeah. I would still encourage people I would certainly encourage kids to go into medicine if they have a love of science and of biology, that they should pursue it. I think developing your problem-solving skills is really an important thing, and just trying to put yourself in a position where you can perhaps interface with people in the medical field early on, maybe volunteer when you're really young in a hospital, or make occasional visits, if you have a relative who is in medicine, to ask them questions and maybe get a chance to spend a day with them in the hospital. Those sorts of things that give you some exposure where you can tell, is this a field that you would really love and excel in?